Today's tip is about management of arthritis at the base of the thumb. This is a very common place that people get arthritis, especially that accumulates over time. We use our thumb for millions of things each day, and it's especially pinching and gripping type of activities that particularly load the joint at the base of the thumb. Over time, those forces start to wear down the joint surface. They also start to stretch out some of the ligaments at the base of the thumb. This ultimately can lead to development of pain when you're pinching something tightly. People very commonly complain about pain when they're opening a bottle or when they're doing buttons on their shirt, or sometimes even pulling up their trousers, things that we do very commonly throughout our normal day. The thumb essentially works as a lever arm, and that means that every ounce of pressure that we apply at the tip of our thumb is multiplied to 12 or 13 times that by the time it gets to the base of our thumb. That leads to that joint having more advanced wear and tear, as well as the stretching out of the ligaments over time. Some of the things that we can do to prevent arthritis from forming there, or to make it less symptomatic when we do have arthritis there, are avoiding those pinching and grasping things. Things like opening a bottle of water, instead of doing it at the tip of our thumb, if we put it in between our thumb and our index finger and turn there, it lessens the load on the thumb. Sometimes people are also using the other side of their hand to open it. Because it's the pinching and gripping activities that very commonly bother people with the arthritis at the base of their thumb, holding a pencil when it's your dominant hand is one of the things that can be very painful. One of the modifications that we can make is making it a wider pencil, or having a wider grip on your pen. Makes it easier on those thumb joints. It makes it easier for you to write for a prolonged period of time, decreasing that pain and making it easier for you to do your normal daily activities. Another nice thing about the thumb joint is it's actually very close to your skin, unlike your hip or your shoulder. And so there are topical anti-inflammatories that we can apply right on there, and the topical will get down to the thumb joint itself. There are also braces that are designed to hold that joint in place and to lessen the stress across that thumb, or to give it extra stability that may have been lost as those ligaments have stretched out. Additionally, there are things such as cortisone injections and other medications that we can give to help decrease that pain and the symptoms at the base of the thumb. Hopefully these tips and tricks prove helpful, and they can benefit you in all your normal daily activities, making it less bothersome for you throughout the course of your normal day.